My name is Ranit Mishori. I am a practicing family physician and I'm professor of family medicine at Georgetown University School of Medicine. I am also the senior medical advisor to an organization called Physicians for Human Rights. Well, what we have seen both in the US and globally is that healthcare professionals, anyone from doctors to nurses to medical assistants to respiratory therapists, have been working days and hours with very limited resources. And by limited resources, I mean personal protective equipment or PPE. Many of them in every country, including the US, have been asked to work under pretty unsafe conditions. Many are not allowed even to bring their own PPE to work. And on top of that, we've heard reports of punitive measures being taken against those who decide to speak out about these unsafe conditions, and even retaliatory measures like citations and terminations of employment. So this is sort of an untenable situation. There have been many, many failures on the parts of institutional, local, federal side in terms of ensuring that facilities are well equipped and adequately resourced to support healthcare professionals. And so the fact that they were working under such unsafe conditions is a violation of their right to health, of their right to safe working conditions. And even with the retaliation against some of them speaking out, it's against their right to freedom of expression. First of all, the retaliation against healthcare professionals must stop. This is not helping anyone. We have to realize that we're all in this together. And if health workers don't feel safe at work, or if they get sick, then there's a trickle-down effect to their patients. Their patients are unsafe, their own families are unsafe, and the entire community is unsafe. There's a role for everybody to play to make sure that healthcare workers at the front line are supported. There's a role for health systems administrators in their hospitals. There's a role for medical organizations to support and back up health professionals. And we at PHR, and along with other health organizations, we released a statement that supports healthcare professionals who demand better PPE resources and demand to speak out about that. So what we're telling our colleagues in the US and in other parts of the world is that we and other medical organizations are standing behind them, and we are going to create all kinds of advocacy channels to try to demand that, one, retaliation be ceased, and number two, that resources are going to be made available in a way that protects everyone who needs that protection, everyone who works with COVID-19 patients, everyone who's exposed to those who are potentially infected. There's a role for public servants, for mayors, for governors, for state representatives, or for elected officials to help secure those protections for health, for frontline health workers. There's even a role for business leaders and manufacturers and supply chain professionals to create these products that are necessary for healthcare workers to do their job and do their job safely. The public needs to recognize that health professionals are putting their lives on the line for the good of the public. Having support from the public, vocal support through letters to representatives, through op-eds, sending food and thank you cards, which is wonderful. But I think when it comes to protection, I think more needs to be done.